Hi guys! This video is about cross-friction massage and why you should really not do that for your Achilles tendinopathy. This video was prompted by one of my patients that I've just come off a call with who, well, is a new patient. He's not seen me before and he's made his Achilles pain so much worse because he followed the advice of two well-known therapists on the internet who were saying do cross-friction massage for 15 minutes a day because it's the very best treatment for your Achilles pain. All that tells me is that those therapists have really not kept up with the latest research, because we know from the research that that is not how the healing process works for Achilles tendons. So I've decided to make this video about cross frictions and Achilles tendon to explain to you how the healing process actually works in a tendon and debunk two myths of cross frictions that is often advocated by people and reasons why you should be doing it. Then I'll explain why sometimes it may appear as if cross frictions is helping your pain. And then lastly, I'll give you a clear reason why I'm dead set against cross frictions for Achilles tendinopathy patients. Excellent. So my name is Maryke. I'm one of the physiotherapists from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment for your injuries. So if you're interested in that, have a look at the description of this video for a link to our website. Okay, so healing process of tendons. Let me get the slides up. Now, this slide that you're looking at is if you looked at an Achilles tendon under the microscope of a healthy Achilles tendon. So you can see that the tendon is made up of collagen fibers, that's the pink bits, and they're all in parallel arrangement. And that's what makes a tendon so strong. Think about it, if you have one piece of string, you can easily break it. But if you've got a few pieces of string together in parallel and you try to break it, they can be really, really tough, even though a single string can be quite thin. So it's the structure of an Achilles tendon that makes it so strong. You'll also notice that there are white bits in between, which is gel-like substance, and then you've got some cells scattered around. Now, if you have Achilles tendinopathy in the early phases of the condition, that's what happens to your tendon. You can see this is a reactive tendinopathy. Those fibers that's parallel arranged are now starting to move away from each other. So you're starting to feel a lump in your tendon. Because the fibers are moving away from each other, you're getting larger cells and more cells coming into the tendon, and you're getting more of that white substance in between the tendon fibers. Now, if the Achilles pain continues for long enough and you develop an ongoing Achilles tendinopathy, then this is what your tendon starts to look like. You've now lost that parallel arrangement in the collagen fibers in that part of the tendon that's injured. And that's why that part of the tendon becomes softer and loses its strength. You also have a different type of cell in there compared to healthy tendon cells. So that's the pathology or how the injury develops over time in your Achilles tendon. You'll notice that's not scar tissue. That is the collagen fibers that's just not arranged as they normally should be arranged. And that's important to understand. Now, let's go back to cross frictions and why it's not a useful type of treatment. So the first myth, why people say you should do cross frictions, is to stimulate the healing process through stimulating inflammation in the tendon. So you grab a hold of that tendon, you really rub it or cross friction it to create an inflammatory response, and that's going to cause healing in the tendon. That's not how tendons heal. What the research is showing is that it needs strength training and careful loading to stimulate those cells to realign into the right alignment and create new strong collagen fibers to replace the old ones or to support the old ones. It doesn't need inflammation. Not in any research study has it been shown that you need inflammation to create new collagen fibers. That's not how this injury works. Yes, for acute injuries like muscle tears and ligament tears and stuff, anything where there's acute injury like that, there we have an inflammatory response within the first 3 to 5 days. But not with a chronic overuse injury like Achilles tendinopathy. With these injuries, you need a carefully loaded program to realign those fibers and to create new strong fibers. Okay. Second myth, it breaks down scar tissue. There's no scar tissue to break down if you've got an Achilles tendinopathy or tendinosis. it's just not what the disease process is about. Yes, there's a lump in your tendon, but that lump is caused by the fibers that's moved slightly away from each other and that's slightly malaligned. You cannot realign fibers through massage. That's not how the body works. It's not possible. If that was possible, we'd all turn into a bit of a blob when we go for massage, and a new trainee is massaging, lo and behold, in the wrong direction. What would happen then? Would he rearrange our fibers in the wrong direction? Our bodies aren't that fragile. It only realigns over time through tensioning it, through loading exercises in a specific direction. So there isn't scar tissue in this condition to break down. Scar tissue forms when you tear stuff. So yes, if you've snapped your Achilles tendon and it's been reattached, then you'll have scar tissue, but not if you've got a tendinopathy or tendinosis. Okay. Well, some people do report that cross frictions can decrease their pain. And yes, massage can have a pain dulling effect on tissue. But that effect does not last. It's a short-lived effect, and we know that through research again. So it can decrease your pain, but then it doesn't strengthen your tendon. So when you go back to your sport, your tendon just becomes painful again. So then you do your cross frictions tonight so your tendon can feel better. Tomorrow you train, tendon hurts again. That's a really useless cycle to be stuck in, because you're just kind of going into a boom and bust cycle. The other reason why it may appear that cross frictions is helping your tendon is that often people will combine it with other modalities. Like, for instance, they'll rest at the same time. So they won't run for a week, they'll just do cross frictions. Now, we know that rest also decreases the pain in tendons. But similarly, we also know that rest doesn't strengthen your tendon. So you get stuck in the same boom and bust cycle of the pain decreases, you go and train again, pain flares back up. Why? Because you've not strengthened the tendon through a load management program and strengthening program. By the ways, people have three kind of reactions to cross frictions. It's either, yeah, can have a pain dulling effect in the short term for them. 2, absolutely no effect. 3, makes them massively worse because it can stimulate inflammation in there. And that's what happened with this patient of mine and so many others that I've seen through the years. Now, why am I dead set against it? Yes, for the obvious reason that it can make people's pain worse, and then it delays their treatment program because now they've got to wait until their acute pain settles down before they can get going with their strength training exercises. But also, it just wastes people's time because they're doing a modality that doesn't actually strengthen the tendon. So even if it doesn't make them worse, they're sitting and waiting for the tendon to strengthen without actually doing the correct treatment. So that's why it makes me so angry when people advocate cross frictions as a brilliant treatment option for Achilles tendinopathy. If a therapist tells you that, you should really run in the opposite direction, because all that tells me is that he's not kept abreast of the most recent research. I should have also mentioned that, by the way, you know how that myth number 1 about stimulating the healing process and even myth number 2, breaking down the scar tissue. I was taught that stuff as well when I studied in probably 2002 around. And that was what we believed at that point. It was a hypothesis though, it wasn't proven through research. Now since then, loads of research has been done to show that actually no, those hypotheses do not hold, do you say do not hold water? Whatever. They're not true, because that's not how tendons heal. So we've got to change what we believe as new research comes out and debunks our previous beliefs. And if a therapist doesn't keep up with the most recent research, they may be applying treatments that was thought to be right when they studied, but is now known not to be correct. Sorry, that was a bit of a tangent I went on to. If you've got any questions, let me know. You're welcome to email me or message me in the comments. But if you want more help with your Achilles tendon, you're also welcome to consult us via video call. Link to the website is in the description of this video. Take care.